So with that, shall I start the recording? Okay, here we go.
This meeting is being recorded.
Okay, so I want to start with what I think is really good news, and that is that the surge that we saw with Omicron is really receding quite quickly. I'm just thrilled to report that for the first time in a really long time, we're averaging fewer than 100 cases per day for the last week. So if we look at the total number of new cases attributable to COVID-19 in our community, we're at 596 new cases over the last week. And we knew that this was coming as we saw a dramatic decrease in testing demands. So that's really good news. And we also know that that doesn't capture everybody, but it is a great sign that the Omicron surge is well behind us. And not surprisingly, our hospitalizations are also trending down, which is, again, wonderful news. Unfortunately, again, as expected, the deaths attributable to COVID-19 continue to rise. Unfortunately, we're adding another 32 deaths attributable to COVID-19 in our community. So to sum it up, the trend is very encouraging for COVID-19 in our community, fewer than 100 cases per day over the last week. And our hospitalizations are down. So this is all very encouraging. It is important that we continue to do everything in our power to continue this trend. All of our jurisdictions are still in high transmission, although I'm really hopeful that by this time next week, we'll be able to report that some of our jurisdictions are in substantial transmission. I will say that we have two outliers, Covington and Craig, particularly Craig County, it's actually trending up, but I think that that's small number variation, and I'm really hopeful that the trend that we're seeing across all of our other jurisdictions is going to be seen in all of our jurisdictions over the next week or two. So bottom line, we're doing really well with respect to a rapid decline in cases associated with the Omicron surge. With respect to other things, we know that people are still getting vaccinated. Vaccine demand is down, which is not at all surprising. We were hopeful that we would have an option to start vaccinating our youngest children to give parents that choice, but that has been postponed. And I think that, to me, that really shows that the FDA is doing its due diligence and that we can have confidence in the process, that they're continuing to look at the data. And when and if that recommendation comes through, we can have confidence that they did their due diligence. And so with that, I will open it up to any questions that you may have.
Dr. Morrow, this is Madison Donor with ABC 13. I'm just wondering, have any local hospitals started with the Pfizer pill? Has anybody received them or started using them on patients?
I'm sorry, with the what?
The Pfizer pill?
Oh, yes. So our hospitals, our healthcare delivery systems have been using the oral antivirals. In addition, I know that there's something called Evusheld, which is a treatment that can be offered to people who aren't able to mount a strong immune response, and Carillion has begun to provide that to patients who qualify. So I think that the bigger question is, or the bigger issue is, that we have more options available in addition to our vaccine, which is, we have variable but strong uptake in a lot of our communities. We also have a lot more treatment options for people who do get COVID. And so right now, all of our healthcare delivery systems do have access to that and are using it. And I think that the big message here is that we're in a very different place today than we were last year with respect to access to vaccines and access to treatment. And together, that's wonderful. And it's certainly wonderful that we seem to be having a very sharp decline in cases associated with Omicron. So for the first time in a long time, I feel like we're in a pretty good place right now. And that doesn't mean we can let our guard down. Don't get me wrong. We're still in high transmission in every jurisdiction, but I am really optimistic that the trajectory is a great trajectory, and I'm optimistic about what this will look like.
Thank you.
There's a question about the, oh, thank you. There's a question in the chat about the mask mandates. Close eye on any student infection rates. I think that I think I continue to have conversations with our schools, our school superintendents, and I'm just really thankful to be in a community where we have such great working relationships amongst the superintendents, with the health department and the superintendents. And once again, I know I've said this so many times, our school superintendents, our school nurses are amazing, and they are so dedicated to doing everything that they can in the interest of the communities that they serve. And I think that we're at a point now where we have very different levels of community transmission. And I know that the schools are doing everything that they can to take into account what's happening at that local level, and they're making their decisions based on what's happening at their local level, with their local school boards, with the legislation, and certainly looking at our community transmission rates. So I'm, again, really thankful for the relationship that we have with our schools. And with respect to whether we're anticipating whether there'll be any spikes, the trajectory of our COVID-19 pandemic post Omicron, well, we're still in Omicron, but right now, I do not expect that we will have any spikes. Now, it's critically important that we all remain humble in the face of COVID-19. It has surprised us time and time again. We can't let our guard down, but I think that it's okay for us to take a look and appreciate that we seem to be in a much better place today. We are in a much better place today than we were a couple of weeks ago. And I am confident that that will continue, at least for the time being. Omicron, came out, surprised us. So we'll have to see if there's anything behind it. But at this point, I think with the amount of immunity that we have, with our vaccine immunity, with our natural immunity, I'm really hopeful that we're looking to a healthy spring. And again, none of us have been able to predict this. So I'm being a broken record right now. Are there any other questions?
Yes, Dr. This is Tom Brewer, WFSR. Question not related to COVID. Last time we met, we discussed an outbreak of Hep A not related to the famous Anthony's case. I wonder if there was an update on that.
Yeah, thank you so much for bringing that up. Unfortunately, we continue to see cases slowly come in. So we're now at approximately 30 cases over the last few months. And again, if you compare that to our yearly average of just 2 to 5 cases per year, we are well above what we should be seeing with respect to hepatitis A. The overwhelming risk factor that we're seeing is substance use disorder. And while substance use disorder in and of itself isn't a risk for fecally orally transmitted virus, we think that it might be associated with other practices that are occurring when people use specifically injection drugs. So we're continuing to work with our partner organizations. We had an amazing partnership last week where we were able to provide approximately 50 doses of hepatitis A, hepatitis B, and COVID vaccine to an at-risk population. And we're going to continue to work with our community partners to ensure that we're providing targeted education and, most importantly, vaccine to individuals who are eligible and for whom this can really make a difference in light of the outbreak that we're having. So thank you for bringing that up, Tom.
Thank you.
Are there any other questions? All right. Well, seeing none and hearing none, please let us know if there's any information that would be helpful to you. We'll continue to provide the weekly update, and I'll see you in a couple of weeks. Thank you so much.
Thank you. We'll be getting the data out and get the recording out to you soon as it's optimized. Thanks. Take care.